That ain't right.
Yeah, there was a recent article that came out that said a medical director never read patients' records. He never read them. He just denied them. The insurance company ended up settling, which is very telling because insurance companies don't normally like to take on responsibility for something. Do we know who the name of that company is? Aetna! Unfortunately, it is Aetna. This was not a case in West Virginia, but it still applies. It still applies to the national issue. We don't have any problems with the people who work here inside this building at Aetna Better Health. There are some wonderful people who work here. Our problem is not with the people. Our problem is with the corporation, their standard operating procedures, and how it affects access to health care by West Virginians. Do you know what the percentage of prior authorization denials is, what the rate of denial is for that in West Virginia? We're talking just the denials that occur before they get treatment, blocking them from getting treatment. 13.7% of West Virginia Medicaid recipients get denied out the gate. Now you add to that claim denials that come after the fact, and you're closing in on 1 in 5. That means 1 in 5 people who go to their doctor and their doctor says, you need to have this treatment, you need this medicine, you need this procedure. 1 in 5 are denied. I can't believe that many medical professionals don't know how to fill out a form properly. Do you?
No!
There's something more at play here. For $260 billion worth of it annually, there's something bigger at play here. We need to contact our Congress members to say and demand that these public funds that are being spent for Medicare and Medicaid and the money that we spend when we're employed and we have a private insurer and we pay that in, we deserve to receive the care that we and our federal government are paying for.
That's right. Yeah. Right.
Are you going to come? All right. I would like to introduce our next speaker. Her name is Pam Garrison. If you look, she is wearing and testifying who she is with. She's with the West Virginia Poor People's Campaign. Here you go, Pam.
Thank you for inviting me and to be able to stand here with you. Like you said, I'm Pam Garrison, Tribe Chair of the West Virginia Poor People's Campaign. We fight against many battles. We stand against systemic poverty, denial of health care, systemic racism, militarism, the false religious nationalism that's rising in our country, and ecological devastation, which West Virginia has got a lot of them battles with. And, you know, I've been a caretaker my whole life. My husband became disabled in his 30s when he fell off a high-rise in D.C. I helped raise my nephew, who is spinal bifida and been in a wheelchair his whole life. I had 2 brothers that died from AIDS. You know, so I know a lot about this healthcare system. You know, and we thought when we got the Affordable Care Act, they were finally going to look at a problem that they had been ignoring for so long, and so many people has died unnecessarily. And you know, we've got doctors and go to school. They learn what they're doing. They know what they're talking about. And so why do they get canceled out by people who are set in an office that has no idea, knows nothing And it's easy to say, well, wait 6 months, wait 6 weeks. When you ain't the one walking in them shoes hurting every day, when you ain't the one in the pain, it's easy to say that when you ain't walking in them shoes. When you ain't the caregiver watching them, doing everything you can to try to help them. Because the system won't.
Preach it. That ain't right.
This is not about one company. This is about a corrupt system. And we need it addressed. And we're sick and tired of begging you to do your jobs.
That's right. That's it.
Tell them.
Now, all of you keep acting like you don't see this problem. It ain't a problem that we're being profiteered for as a commodity. Well, you know what? Health care is not a privilege. Health care is a necessity. Just like your water, your air, your utilities, whatever. They need regulations. We need oversight. We need real people with real solutions instead of just sitting blaming the people. So I want you to know, Poor People's Campaign, we're with you. We're in this fight. And you let us know where we need to be, what we need to do, and we will be calling our Congress people. Our House representatives, I've been to see them many a times. They try to ignore us and send their aides to see us, but they can't deny us. They cannot deny us because the more of us who get together, the louder we are.
We'll be there.
And they will hear us at the ballot box.
That's right.
So if you want change, get everybody you know to vote. We need good people. We need good people. Run. Good people run. We need you. Doctors run.
Yeah.
Thank you. Thank you.
Thank you so much. That was Pam Garrison, co-chair of Poor People's Campaign in West Virginia. And, my name is Gary Zuckett. I'm Executive Director of West Virginia Citizen Action. And People's Action is our national. But I'd like to bring up next Mabry Davis with the New Economy Works in West Virginia. He's got a few words to say about healthcare justice.
Not here. We'll get back to the
All
office.
right.
I'll get more involved.
So, what do we say? People over profit.
People over profit.
Care over cost.
Care over cost.
People over profit.
People over profit.
Care over cost.
Care over cost.
So, right now, we're standing outside of Aetna's offices, right? Their parent corporation, CVS Health, paid to their CEO, Karen Lynch, $21 million last year. What CEO you know should make $21 million?
Nobody.
Should one person be making $21 million when our grandmas are getting denied health insurance? No, that ain't right. Now, CVS Health, they also took a $6 billion in profit from their Aetna insurance division in 2022 alone.
That's right.
$6 billion with a B.
That's what it
$6 billion with a B, right? And they spent over $20.57 million on lobbying in 2021 and the 2022 cycle, right? So we always say, well, I'm not about politics and I don't get into all of that stuff. Well, we can't take that position because the politics, they in there making decisions about our health care and the way we need to live our lives, and we're missing, right? So we need to show up and let them know that we're not going to take any more them counting profits over the people, right?
That's
We're not going to take them denying health care to our friends and family because they just want to make a little bit more money. You know, and here's another thing. You know, we talk about this private health care and everything. What we really need is a single payer system. We really need a single payer system, and let me tell you why. As our organization focuses on business development, small business development, they can't compete when they can't provide people health care. Well, people have to go and work at all of these places that they don't want to work just for the chance at getting health care, and then it don't even pay out for them. So we need single payer. We need single payer because it would make our small businesses more competitive. It would allow people to have their basic needs met and taken care of so that they can focus on, that's right, people over profit.
People over profit.
Care over cost.
Care over cost.
I mean, that's really all I gotta say. We need to focus on getting rid of these big insurance companies that only care about paying their CEO big money and not taking care of the people. So I'm here to urge y'all to push our Congress people, push your representatives to fight for a single payer system, because that's what we need. It will increase small business in West Virginia, and it will make us more competitive. Thank you, Mary. I just want to share one little more factoid with you about the mindset of the for-profit insurance industry. What do you think the bean counters at the big insurance calls it when they have to provide you with the health care that you deserve? They call it a medical loss. On their books, they put it down as a loss because they lost money because they had to give you health care. That ain't right.
That ain't right.
That's what we pay them for.
And basically what they're doing is they're killing people by denying care. So what we're going to do now before we leave is we're going to do a die-in here on the sidewalk. We're going to get out the sidewalk chalk, and anybody that wants to can lay down, and we will outline your body on the sidewalk, and we will leave that for the executives up at Aetna to see when they come off of work today. What do you think?
Yeah.
Thank you very much.
Thank you so much, Gary. What I'm going to do is I'm going to tell you all some healthcare stories. And when I tell you that healthcare story, if their lack of care would put their life in danger, you lay down at the end. And you represent that person who can't be here today.
All right.
Does that sound cool? Anybody who can get down. Because I know some of us got some problems getting back up. So, don't be shy to ask for a hand from a friend. Is that about to take stand?
Free air advertisement.
So a lot of the reasons they're going to tell you for why the claim denials shouldn't be that big of a concern, that it just happens. You know, there's going to be coding errors, there's going to be not enough information provided, etc. We understand that's a certain percentage of it, I'm sure. But the lion's share of these denials are coming from a system that is put in place to make it difficult to appeal your claim. So I'm going to give you another number, okay? 0.2%. Take a penny, cut it into 100 pieces, and take two of them tiny little pieces. That is 0.2%. 0.2% of claims are appealed.
What? That ain't right.
2% of claims are appealed. If they weren't making it difficult to appeal claim denials, we would not have only 0.2% cases appealed.
Amen.
Right.
That's right.
Right.
That's right. They put hoops and hurdles in your way. They make it difficult from the get-go. So difficult that even the medical officers have problems reapplying complaints. So I'm going to tell you some stories. And I might ask Brian to step in to help us tell us you as well. I have a close friend. He has a hernia. If you take the cabbage, the size of the cabbage, just kind of do this with your hands, and then put that right at your navel. That is the size of his hernia. That is how big it has become over the years. Why does it continue to grow? Why are they not fixing it? Because they continue to deny his claim, saying that it's not life-threatening.
That ain't right.
You tell me that a cabbage-sized hernia ain't life-threatening.
It is.
I mean, honestly.
Right.
POTS is a neurological issue that affects the heart. And it can cause an Olympic storm. But one part of the heart beats at a different rate than the other. This can be excruciatingly painful, likened to the pain of a heart attack, and it can go on for hours. I have a friend who has this condition, managed to get some treatment, but the best treatment for it is a pacemaker. A pacemaker is not that complicated of a procedure these days. They can do it laparoscopically. But they won't cover my friend's pacemaker because it's quote unquote not life-threatening because his heart works mostly.
That ain't right.
That ain't right. I have another friend who's diabetic, and they received a claim denial from Aetna saying that they don't think they should have to cover them seeing their diabetic specialist because, I don't know why, my friend is diabetic. Maybe they need to see someone who understands diabetic problems, but they don't want to pay for it. And if a diabetic would get in the business, wouldn't think happen? They die. Brian, do you want to switch out?
Hey y'all, my name's Brian Greenwood with People's Action. Hair over cost! People over profit! So this is a big problem right here in West Virginia, but I'm going to tell you today, at 50 locations across the country, people are out demonstrating in front of private health insurance corporations that are profiting off their care. People are in front of Aetna right now in Portland, Maine, Hartford, Connecticut, in front of Blue Cross Blue Shield in Rochester, New York, and they're going to be Chicago, Illinois. There are going to be tons of other places across the country. And I'm going to share a couple of stories of people who've been denied care at those places. So first I'm going to share my story. So a couple years ago, I got injured on the street. Somebody called 911 on my behalf. I got taken by firefighters into an ambulance, taken to the hospital, patched up, sent home. And then you know what happened? They sent me a bill. My health insurance company wouldn't pay for an ambulance ride for me to go to an emergency room. That ain't right. Next, I'm going to tell you all the story of Jen Crawford. Jen lives in New Hampshire. She has complex regional pain syndrome. She, after a breast cancer, she had breast cancer, mastectomy went bad, and she got complex regional pain syndrome. She spent years in bed, unable to get out of bed for years. Her doctors prescribed medicine that would make her all right. Her insurer, United Healthcare, that made $20.1 billion in profit. $1.1 billion in profit wouldn't pay for the care that Jen needed. She sold her car, her belongings. We fought back to get her care, and now United Healthcare is still delaying our pay. That ain't right.
That ain't right.
And then let me tell you about Carly Morrison. Carly lives in North Pennsylvania. She's also on United Healthcare, and Carly has a thing called neurogenic median arthritic ligament syndrome. It means she cannot eat. She is on CPN. She has had intravenous food. There is a majority chance she would die in the next 5 years if she didn't get a surgery. Her insurer made $20 billion in profit. You think they'd pay?
Nope.
Good life-saving surgery for Carly? No, because they're putting profit over people. We fought back. We got Carly her surgery. We embarrassed the company, and now they're still trying to stick her with the bills. Right? She hasn't eaten for years.
That ain't right. Care of cost.
Life-saving surgery, and they want her to pay. That ain't right. We're gonna fight back for Carly. Make sure she gets the care that she needs. I bet I'm not alone. I bet there are other stories here. Who's got a story? Somebody you love. You yourself or somebody in your life. Okay.
So we go to events sometimes and host booths and have people sign up, and I had this fellow telling me he was in a car wreck, he lost a leg, his insurance company didn't want to cover a prosthetic leg. That ain't right!
Pitiful.
Sally, would you like to come up here and share a story?
And I'll tell you, it is not only these major problems, but it is also everyday people. All of us have experienced denial of care with our health insurance company for something that we desperately need. I'm an asthmatic. They have denied most of my asthma medication, and every single time I have to renew my medication, I have to call in and fight with the insurance company to get it covered. I have also seen that I have a brother-in-law who is in California who has been waiting for 4 years to get his shoulder replaced, his shoulder surgery.
All right, now the English side?
Waited for 4 years.
I got the picture.
And
Now you want the one
so
with
much
the other side of it?
that he nearly committed suicide
I got
and
you
was
covered.
rushed to the
want the
hospital
English
for
side out? See the
inpatient
Spanish one
care
for one?
because his pain is so
there you go.
debilitating
I snapped a couple. It's pretty
and
good.
so depressing to him that he has had to wait for the surgery. Every 6 months he goes to the doctor. Every 6 months they tell him, well, just wait.
That ain't right.
So the story that I want to tell today is my own. Because for years, I have fought with doctors and health insurance companies for life-saving surgery. Because I have a condition that not only puts me at greater risk every year of heart attack, stroke, and other fatal things, but I walk around every day running the risk of organ rupture or perforation. I've been in the hospital multiple times for internal bleeding. I have to have surgery every year to 2 years to patch up the problem because no one thinks that my life has enough value to fix the problem. Right. They would rather keep me sick and keep me broken and keep me in crippling pain rather than focusing on the fact that health care is supposed to care for people.
Yeah.
And
That's right.
And now I'm going to ask if somebody with chalk will meet me right now, because if things don't change right here,
Let's go.
it's going to be me one day.
That's right.
That ain't right.
That ain't right.
That ain't right. And I want to thank everybody for coming out today, because I think we've made our point, and I appreciate you all coming out to say that we need to put people over profits, and we need to put care over cost. And we need to call out the greedy insurance companies that call it a medical loss when they have to give you the health care that you need.
That's right, Gary.
Yeah!
So earlier, before this demonstration, and you awesome, wonderful people showed up, we delivered by hand a letter to the Aetna officers here. They were kind enough to receive us and listen to us, and they promised that they will meet with us and schedule a meeting so that we can talk in more detail about our demands.
That's a win!
So that's promising, that's progress. But what I would like to do is read to you those demands. There's nothing ridiculous about it. We just want responsible accountability. We are demanding Aetna and other insurance companies that provide health care to take the following steps to remedy this current egregious situation. We want them to audit and reimburse federal and state governments for the public money diverted by claim and prior authorization denials within Medicaid and Medicare. We want them to never sign contracts forcing retirees on traditional Medicare to move on to Medicare Advantage plans. That's part of that whole Medicare REACH program.
Yeah.
It's egregious.
Yeah.
We want them to stop denying claims
Yes.
and overturn any existing denials for treatments recommended by medical professionals. I want those medical professionals to provide that medical care that has been paid for by our federal funds.
Yes!
Provide transparency around denied claims and prior authorization claims by market, plan, state, geography, gender, disability, and race. What does that mean? We need the numbers. We need the breakdowns. We need the demographics because we need to find out, and it's very likely, given what we know, that there are people who are receiving less treatment than others because of things like how much money they earn,
Right.
or the color of their skin,
Yep.
or how old they might be. That ain't right.
No, that ain't right.
So we need them to provide us that data. We need them to share monetary value of total denied claims and prior authorization. We need it broken down by internal and external appeal processes and total percentage of profits taken by denying care for corporations, by corporations. What that means is we need to know in transparency and reporting how much money they're making off of that claim denial.
Yeah.
We need them to hold monthly open microphone meetings with policyholders to discuss problems with their insurance products, including things like egregious amounts of claim denials.
Yeah.
And making the obstacle of the appeals process easier to manage.
Yeah.
You know, my roommate got a denial letter from Aetna in the mail. There was all this white space at the bottom of the letter. No information of how to do the appeal. So, I mean, they don't even have to spend any more money and still improve how people can appeal. We need them to relinquish ownership of and transfer over the claim appeals process to relevant public authorities. We need to reverse the specific care and claim denial in cases we bring in an in-person meeting. When we bring those cases to them, we need the reverse in cases that we bring to them. And we need them to cease overriding the will of the people.
Yep.
Cease overriding the will of the people.
That's
Who need health care by lobbying and donating their members money to politicians' campaigns, PACs, and any other entities that can advocate for or against the defeat of elected officials. They're using our health care premiums
Against us.
to lobby so that they can continue denying care and making profits.
Yes, that's right.
Right.
Follow the will of the people. Provide the care we've paid for.
Yes.
People over profit.
People over profit.
Care over cost.
Care over cost.
You got one more,
I
Mary?
got one more to add.
We should also demand that they put a cap on CEO profit.
All
They
right.
put a cap on the CEO profit.
I agree.
They want to put caps on us, we need to put caps on them.
Yeah. How about a CEO payment copay?
Right. How about your salary goes down the more claims you deny? Your salary should go down the more claims you deny.
Heck yeah. Accountability, transparency. That's all we're asking for. We're asking for people to get the care that they've paid for.
Right.
To allow their doctors and their medical professionals to provide the care that they have said this person needs.
Yes.
Amen.
Accountability and transparency is how we get it done. And guess what? Was it middle of September, the letter? September 18th, I believe. Over 100 organizations signed on to a letter from People's Action sent to the Department of Health and Human Services Health Committee, asking them to investigate these healthcare profiteering practices. And you know what?
All right.
They're investigating.
All right.
So when people get together, change can happen.
Amen. Solidarity.
Call your Congress members. Demand that we get the health care that we paid for. Care over cost.
Care over cost.
People over profit.
People over profit.